So let's open it up with some questions.
So when you say that it's going to be translated over to humans very soon, about how soon can we see it in use for a type of cure for Hep B?
Well, the Hep B trials are enrolling. They're longer, and I would say we would get results at the end of this year or the beginning of next year.
Thank you very much.
Yeah. For HIV, we'll get very preliminary results probably in early 16. But please speak with Dr. Gelajunas to clarify that.
Hi, Jeff Beer, Positively Aware. So, Dr. Simonetti, it seems like from your work that it looks like there is a potential danger to shocking the immune system and bringing this latent reservoir, waking them up because they can proliferate. But on the flip side of that, you know, I just wonder if there's anything in the work of others at the table here to counteract that. So, I mean, what do you do when you wake it up and there's a potential for damage or danger? How does that move forward in a clinical trial setting?
Well, in every intervention to wake up the reservoir, there's always therapy there. So even in the patient we studied, part of this clone was active, was expressing this infectious virus, but a fully suppressive regimen was there to block new infection events. So even if we're trying to reverse latency, and in this case, something within the patient was reversing the quiescence of this clone, therapy is there to prevent the infection of new cells.
But your question's important. Anytime we wake up virus and expose the immune system to virus, you might trigger the inflammatory activation response that is shown to be deleterious. But these will be probably short-lived, nothing like uncontrolled HIV infection, short-lived bursts like in the monkey, but that's something that will need to be monitored carefully.
Could you just talk a bit about the 9620 trial design?
I'd have to defer to Gilead for any human clinical questions. You can certainly ask Romas.
So it's going to be a small study, about 24 patients, and there will be 3 dose groups, and the doses that will be utilized will be comparable to the hepatitis B trial that John referred to earlier. So.
Any final questions? Mark has informed me that we're a little bit short on time. So I encourage you to speak to the panelists once we break up, Dr. Maldarelli, Hughes, or Dr. Gelajunas afterwards if you have any additional questions or you need some good quotes. These are all smart and insightful people who have a good sense of humor, so they're fun to talk to. Thank you.